When we are young, blood flow through the body happens almost effortlessly. Our blood vessels are soft, elastic, and highly responsive. Every time the heart beats, arteries expand and relax smoothly, allowing oxygen-rich blood to travel easily from the heart to the legs, feet, and even the smallest capillaries in the toes. A major reason this works so well is a tiny but powerful molecule called nitric oxide. Nitric oxide acts like a natural relaxer for blood vessels. It tells them when to widen, when to stay flexible, and how to respond to changes in blood pressure and movement. As we grow older, this system slowly begins to change. The inner lining of our blood vessels, known as the endothelium, becomes less efficient. This lining is responsible for producing nitric oxide, but with age, inflammation, poor diet, and inactivity, its ability to do so declines. When nitric oxide levels drop, blood vessels lose their ability to relax properly. Instead of widening easily, they remain slightly tight and stiff. This narrowing may be subtle, but over time, it significantly reduces blood flow, especially to areas furthest from the heart, like the legs and feet. This is why many seniors notice that their feet feel colder than they used to, or that their legs fall asleep more quickly when sitting. It is not always a nerve problem at first. Often, it is a circulation problem caused by stiffened vessels that can no longer deliver oxygen efficiently. Without enough nitric oxide, blood struggles to move freely, and tissues begin to experience low-grade oxygen deprivation. The body may not register this as sharp pain, but it does register it as numbness, tingling, or that uncomfortable pins and needles sensation. What makes this especially frustrating is that this process happens gradually. People adapt to it without realizing what is happening inside their bodies. They assume it is just old age and that nothing can be done. But the truth is, while aging is inevitable, severe circulatory decline is not. Blood vessels respond extremely well to the right signals, even later in life. Gentle movement, proper breathing, and supportive nutrition can stimulate nitric oxide production again. The body does not forget how to heal. It simply needs the right reminders. Understanding this first point is critical because it explains why circulation problems often appear without any obvious disease. A person may have normal heart tests and still suffer from numb feet. The issue is not the heart itself, but the condition of the blood vessels and the chemical signals that keep them flexible. Once this is understood, the solution becomes much less intimidating and far more achievable. Most people think about circulation only in terms of blood going out from the heart, but the return journey is just as important. Arteries deliver blood downward with the help of the heart's pumping force, but veins must bring that blood back upward against gravity. To do this, veins rely on tiny one-way valves that open and close to keep blood moving in the correct direction. When these valves are strong, blood moves upward smoothly, even from the feet. As we age, these vein valves begin to weaken. They may not close as tightly as they once did, allowing some blood to slip backward. Over time, this backward leakage leads to blood collecting in the lower legs and feet. This is known as blood pooling. Gravity plays a constant role here, pulling blood downward whenever we sit or stand for long periods. When the valves cannot fully resist this pull, blood remains trapped below. Blood pooling is the main reason seniors experience heavy, swollen legs, especially toward the end of the day. Shoes feel tighter, ankles appear puffy, and legs feel tired even without physical exertion. This is not simply fluid retention, it is a circulatory inefficiency. The blood that should be moving back to the heart is instead lingering in the lower body, increasing pressure inside the veins. When blood stays stagnant, it delivers less oxygen and removes waste products more slowly. This creates an unhealthy environment for surrounding tissues, including nerves. The longer blood remains pooled, the more discomfort builds. Nerves begin to misfire, resulting in tingling, burning, or numbness. Many people assume this means permanent nerve damage, but in many cases, the nerves are simply reacting to poor circulation. The important thing to understand is that vein valves themselves cannot be strengthened with medication alone. What truly supports them is muscle activity. Veins depend on surrounding muscles to squeeze them gently, pushing blood upward and assisting the valves. Without this assistance, valves struggle to do their job, no matter how healthy the heart is. This explains why circulation issues can exist even in people with normal blood pressure and no heart disease. The problem lies in the return system, not the pump. Recognizing this shifts the focus away from fear and toward practical, physical solutions that work with the body instead of against it. The human body was designed for movement. One of the most important movement-based systems in circulation is the venous muscle pump, especially in the calves. The calf muscles are often called the second heart because every time they contract, they squeeze the veins running through them and push blood upward toward the heart. This pumping action is essential for healthy circulation in the legs. When we walk, shift our weight, or even move our ankles, this pump stays active. But when we sit for long periods, especially without moving our legs, the muscle pump essentially turns off. The calves remain relaxed, the veins are not squeezed, and blood begins to slow down. Gravity takes over, pulling blood downward and allowing it to pool in the lower legs and feet. Modern lifestyles have made this problem far worse. Many seniors spend hours sitting while watching television, using phones, or resting out of fear of falling or fatigue. While rest is important, too much stillness creates a perfect environment for circulatory stagnation. Even if the heart is beating normally, blood return from the legs becomes inefficient when muscles are inactive. This is why people often feel numbness or tingling after sitting for a long time and then standing up. The sensation is not random. It is the result of temporarily reduced blood flow to the nerves. Once movement resumes, circulation improves and sensation gradually returns. This alone proves that the problem is functional, not permanent. The encouraging part is that the venous muscle pump responds immediately to even gentle movement. You do not need to stand up or walk long distances. Simple seated movements, such as lifting the heels or rocking the ankles, can reactivate the pump within seconds. Blood begins to move again, pressure in the veins decreases, and oxygen delivery improves. This point is powerful because it shows that circulation is not something that only doctors or medications control. It is something the body manages moment by moment through movement. Even 1 minute of intentional motion can make a meaningful difference. Once people understand this, they stop feeling helpless and start feeling empowered. When blood begins to pool in the legs, the body experiences a very specific kind of discomfort that many seniors recognize instantly. It often starts as a feeling of heaviness, as if the legs are weighed down or filled with sand. Walking feels more tiring than it should, and standing for even short periods becomes uncomfortable. By the end of the day, socks may leave deep marks around the ankles, shoes feel tighter, and the legs may look visibly swollen. This is not simply fluid retention or weight-related swelling. It is the direct result of blood lingering too long in the lower extremities. Blood pooling increases pressure inside the veins. Over time, this pressure forces fluid out of the blood vessels and into the surrounding tissues, which is what causes swelling. The longer this pressure remains, the more pronounced the swelling becomes. This is why symptoms are often mild in the morning and worsen throughout the day. Overnight, when the body is horizontal, gravity no longer pulls blood downward, allowing some of that pooled blood to return to the heart. But once the day begins and sitting or standing resumes, the cycle starts again. This stagnant blood does more than cause swelling. It reduces the delivery of oxygen and nutrients to the tissues in the legs and feet. Muscles become fatigued more quickly, and nerves become irritated. The result is discomfort that may feel dull and achy rather than sharp or dramatic, which is why many people underestimate its seriousness. But chronic heaviness is not harmless. It is a sign that circulation is struggling and that the lower body is under constant stress. Another overlooked effect of blood pooling is inflammation. When blood does not move efficiently, waste products are not cleared properly. These waste products irritate blood vessel walls and surrounding tissues, creating low-level inflammation. Over time, this inflammation further stiffens blood vessels and worsens circulation, creating a self-perpetuating cycle. This is why addressing blood pooling early is so important. Once the cycle deepens, symptoms become harder to reverse. Understanding this point helps explain why quick fixes rarely work. Elevating the legs or wearing supportive socks may provide temporary relief, but unless blood is actively being moved through the system, pooling will continue to return. True improvement requires restoring motion and pressure changes within the veins themselves. Nerves are living tissue, not wires made of metal. They require a constant supply of oxygen, glucose, and nutrients to function correctly. When circulation slows, nerves are often the first tissues to suffer. This is because they are highly sensitive to changes in blood flow. Even a small reduction in oxygen delivery can disrupt how nerves transmit signals, leading to abnormal sensations such as tingling, burning, buzzing, or numbness. The familiar pins and needles feeling is not random. It is a distress signal from nerves that are not receiving what they need. In the legs and feet, this problem is especially common because these areas are farthest from the heart. When circulation becomes inefficient, the body prioritizes vital organs and extremities receive less blood. Over time, nerves in the feet begin to misfire, sending confused or exaggerated signals to the brain. Many people assume that once numbness appears, nerve damage must be permanent. This belief causes fear and resignation, leading people to stop looking for solutions. However, in many cases, the nerves themselves are not destroyed. They are simply under-oxygenated. This condition is often reversible if blood flow is restored before permanent damage occurs. One key clue that numbness is circulation-related is how it changes with movement. When a person shifts position, moves their ankles, or stands up, sensation often improves temporarily. This immediate change would not occur if the nerves were permanently damaged. It happens because movement increases blood flow, delivering oxygen to starving nerves. This temporary relief is a powerful indicator that circulation is the root problem. Ignoring this symptom is risky. Prolonged oxygen deprivation can eventually lead to structural nerve damage. What begins as intermittent tingling can become constant numbness or burning pain. This is why early intervention matters. Improving circulation does not just reduce discomfort. It protects nerve health and prevents long-term complications that are much harder to treat. One of the most common misunderstandings about circulation problems is the belief that they are always caused by blocked arteries or heart disease. While arterial issues do exist, they are not the primary cause of most age-related leg discomfort. In many seniors, arteries are delivering blood downward reasonably well. The real issue lies in the return system, veins and the muscles that support them. Veins do not have the strength or pressure of arteries. They depend on surrounding muscles to help move blood upward against gravity. When muscles contract, they compress nearby veins and push blood toward the heart. When muscles relax, vein valves prevent blood from falling backward. This system works beautifully when muscles are active, but it fails when muscles remain still for long periods. Modern sedentary habits disrupt this natural process. Sitting for hours at a time leaves leg muscles inactive, depriving veins of the assistance they need. Blood return slows, pressure builds, and symptoms develop. This explains why many people experience circulation problems despite having normal heart tests and no diagnosed arterial disease. The pump exists, but the support system is offline. This understanding is empowering because it shifts the solution away from fear-based thinking. If the problem were primarily arterial, options would be limited and invasive. But because the problem involves muscle movement, the solution becomes accessible. Gentle, intentional movements can restore function without stress or risk. Even small movements matter. Ankle motions, calf contractions, and foot activation create pressure changes that veins depend on. These actions restart the muscle pump, reduce pooling, and improve oxygen delivery. Over time, consistent movement retrains the circulatory system to function more efficiently, even in older age. Recognizing that circulation is a dynamic system, not a static one, changes everything. It means that improvement is possible at any age. The body responds not to force, but to rhythm, consistency, and gentle stimulation. One of the biggest mistakes people make when they hear improved circulation is assuming they need intense exercise. Running, heavy workouts, or long walks may sound helpful, but for many seniors, these options are unrealistic or even risky. The truth is, circulation does not improve because of intensity. It improves because of consistent pressure changes inside the blood vessels, and those pressure changes come from movement, not strain. Gentle, targeted movements activate the exact muscles responsible for moving blood without stressing joints or exhausting the heart. The calves and feet are especially important because they directly assist venous return. Even small contractions in these muscles can significantly increase blood flow. This is why a person who gently moves their ankles while seated often has better circulation than someone who exercises hard once a week but remains sedentary the rest of the time. Intense exercise can actually backfire in older adults. It can cause fatigue, inflammation, and fear of injury, which leads to longer periods of inactivity afterward. Gentle movement, on the other hand, encourages consistency. When something feels safe and manageable, people are more likely to do it daily, and daily movement is what keeps blood flowing smoothly. The circulatory system responds best to rhythm. Small, repeated movements create a steady pumping effect that veins depend on. This steady rhythm prevents blood from pooling and keeps oxygen delivery stable. Over time, the body adapts to this pattern, improving circulation even during rest. This is why seniors who move gently but frequently often feel warmer, lighter, and more energetic than those who push too hard occasionally. Understanding this point removes pressure and fear. Improving circulation does not require athletic ability or pain tolerance. It requires awareness and intention. When movement is approached as support rather than punishment, the body responds with cooperation instead of resistance. Many people underestimate how powerful seated movements can be. There is a common belief that circulation only improves when standing or walking, but this is not true. Blood flow responds to muscle contraction, not body position. Even while seated, activating the muscles of the feet and calves can restart the venous pump within seconds. When the ankles move, calf muscles contract and relax rhythmically. This creates a squeezing action on the veins that run through them. Each contraction pushes blood upward, and each relaxation allows valves to reset. This simple mechanical action is enough to move stagnant blood out of the lower legs and restore oxygen delivery to the tissues. What makes seated movements so effective is their accessibility. They can be done anywhere, on a chair, on a couch, even in bed. There is no excuse barrier, no special clothing, no equipment, no preparation. This removes resistance and increases compliance, which is critical for long-term improvement. Many people notice immediate changes when they begin these movements. Feet feel warmer, numbness eases, and the heavy sensation in the legs starts to lift. These changes are not placebo effects. They are physical responses to improved blood flow. When oxygen reaches nerves again, their signaling stabilizes. When pressure inside veins drops, swelling reduces. This immediate feedback is powerful. It builds trust between the person and their body. Instead of feeling broken or helpless, they see proof that their body can still respond positively. That sense of control reduces anxiety, which itself improves circulation by lowering stress hormones that constrict blood vessels. vessels. Seated movement is not a temporary trick. When done regularly, it retrains the circulatory system. Veins become more responsive, muscles stay engaged, and blood flow becomes more efficient even during periods of rest. This is why such simple movements often outperform complex exercise routines for seniors. When it comes to circulation, the body values consistency above all else. A few minutes of movement spread throughout the day is far more beneficial than one long session followed by hours of stillness. Blood flow slows quickly when muscles stop moving, but it also improves quickly when movement resumes. This means the circulatory system thrives on frequent reminders rather than occasional intensity. Many people believe they need to do a lot to see results, which often leads to doing nothing at all. They wait for the perfect time, enough energy, or ideal conditions. But circulation does not need perfection, it needs repetition. Even 1 minute of movement, repeated multiple times a day, can prevent blood from pooling and keep oxygen delivery stable. This is especially important for nerve health. Nerves do not require massive surges of blood. They require a steady, reliable supply. Consistent movement ensures that nerves are never deprived for long periods. Over time, this prevents irritation and allows healing to occur. This is why numbness often improves gradually, rather than suddenly. The nervous system heals through stability, not shock. Consistency also protects against setbacks. When movement becomes part of daily routine, circulation remains resilient, even on low-energy days. The body no longer depends on motivation, it responds automatically. This reduces flare-ups of swelling and discomfort, and creates a sense of predictability and control. Perhaps most importantly, consistency builds confidence. Each small action reinforces the belief that improvement is possible. That belief encourages continued effort, which further improves circulation. This positive loop is far more powerful than any single intervention. Circulation is not restored by force. It is restored by cooperation between the body and daily habits. When movement becomes gentle, frequent, and consistent, the body responds with better flow, healthier nerves, and greater comfort. The feet and ankles are often overlooked when people think about circulation, yet they play a critical role in keeping blood moving. Beneath the surface of the lower legs lies a network of deep veins surrounded by powerful muscles, especially in the calves. These muscles are designed to act like a mechanical pump. Every time the foot moves, when the heel lifts, when the toes flex, or when the ankle rocks, these muscles contract and squeeze the veins, pushing blood upward toward the heart. When this pumping action stops, blood slows almost immediately. Sitting still for long periods allows blood to settle in the lower legs, increasing pressure and reducing oxygen delivery. Targeted foot and ankle movements directly reverse this process. Unlike general movement, these specific actions focus precisely on the muscles responsible for venous return. This is why they are so effective even when performed gently and for short periods. What makes these movements especially valuable is their precision. They do not rely on full body effort or cardiovascular strain. Instead, they use biomechanics. The ankle joint acts as a hinge, and the calf muscles function as pistons. With each controlled movement, blood is forced upward, valves reset, and circulation improves. This happens regardless of age or fitness level. Another advantage is safety. Seniors often avoid movement out of fear of falling or pain. Targeted foot and ankle exercises eliminate these concerns because they can be done while seated or supported. This removes the mental barrier that often prevents people from engaging in circulation-improving activity. When movement feels safe, the body relaxes, further improving blood flow. Over time, regular activation of this muscle pump strengthens the efficiency of the entire venous system. Veins become more responsive, swelling decreases, and the sensation of heaviness fades. This is not because the veins themselves change structurally overnight, but because the system is finally being used the way it was designed to function. Nerves do not function in isolation. Their health depends heavily on the quality of blood flow surrounding them. While circulation delivers oxygen and nutrients, nerves also require stimulation to maintain proper signaling. Without stimulation, nerve communication becomes sluggish, inaccurate, and eventually impaired. This is why numbness often feels worse after long periods of inactivity. Gentle stimulation of the feet and toes sends signals through sensory pathways to the brain. These signals remind the nervous system how to fire correctly. However, stimulation alone is not enough. If blood flow remains poor, nerves may still struggle to recover. This is why pairing nerve stimulation with circulation improvement is so powerful. When blood flow improves, oxygen and nutrients reach the nerves. When stimulation occurs at the same time, nerves are encouraged to use those resources effectively. The result is clearer signaling, reduced tingling, and improved sensation. This combination addresses both the cause and the symptoms simultaneously. This explains why simple actions like spreading the toes, flexing the feet, or gently rolling the soles can have such a noticeable effect. These movements wake up nerve endings while also promoting blood flow. Over time, this dual approach can significantly improve balance, coordination, and comfort. Another important benefit of nerve stimulation is brain engagement. Sensory input from the feet helps the brain maintain accurate maps of the body. When this input decreases, balance and awareness suffer. By reintroducing regular stimulation, the brain regains confidence in the lower limbs, reducing fear of movement and improving overall mobility. This process does not require force or discomfort. In fact, gentle stimulation is more effective than aggressive pressure. The nervous system responds best to calm, repeated signals. When paired with improved circulation, these signals create an environment where healing becomes possible rather than stressful. Circulation is dynamic. It responds moment by moment to how the body is used. This means that improving blood flow is not about a single effort, but about reinforcing healthy patterns throughout the day. Performing circulation exercises multiple times daily keeps blood moving and prevents long periods of stagnation. Short, frequent sessions are especially effective because they interrupt inactivity. Even 1 minute of movement can reset the system. Blood pressure inside the veins drops, oxygen delivery improves, and nerves receive nourishment. When this happens repeatedly, the body begins to maintain better circulation even between sessions. This approach aligns with how the body naturally functions. Historically, humans moved regularly throughout the day. Modern routines have replaced that movement with prolonged sitting, which disrupts circulation. By reintroducing small bursts of movement, the body is simply returning to its natural rhythm. Consistency also reduces symptom flare-ups. Instead of waiting for discomfort to appear, regular movement prevents it from developing. Swelling stays under control, numbness decreases, and energy levels stabilize. Over time, this consistency trains the circulatory system to function more efficiently, even during rest. Perhaps most importantly, multiple daily sessions reduce pressure on motivation. A single long workout can feel overwhelming, but a few short movements feel manageable. This increases adherence, which is the true driver of long-term improvement. When circulation care becomes part of daily life rather than a task, results become sustainable. Lasting change does not come from effort alone. It comes from alignment between habit and biology. When movement is gentle, frequent, and intentional, the body responds with resilience and recovery rather than resistance. Improving circulation is not only about movement, it is also about giving the blood vessels what they need to function properly. One of the most important nutrients involved in healthy circulation is nitric oxide. As discussed earlier, nitric oxide allows blood vessels to relax and widen, making it easier for blood to flow. While the body naturally produces nitric oxide, this ability declines with age, inflammation, and inactivity. Fortunately, certain foods can strongly support this process. Leafy green vegetables such as spinach, arugula, and kale are rich in natural nitrates, which the body efficiently converts into nitric oxide. Beets are especially powerful in this regard. When consumed regularly, they can measurably improve blood flow and even help regulate blood pressure. This is why many people notice warmer hands and feet after adding beets or beet juice to their diet. What makes these foods so effective is that they work with the body rather than forcing change. They enhance the chemical signals that blood vessels already use to regulate themselves. Over time, this improves vessel elasticity, allowing them to respond more efficiently to movement and pressure changes. For seniors, this flexibility is essential. Stiff vessels limit circulation even when muscles are active, so restoring this elasticity amplifies the benefits of physical movement. Dietary support also reduces strain on the heart. When blood vessels are relaxed and open, the heart does not need to work as hard to pump blood. This creates a positive feedback loop where circulation improves system-wide, including in the legs and feet. Nutrition in this context becomes a form of gentle therapy rather than strict restriction. As blood vessels age, they are exposed to ongoing oxidative stress. This stress comes from normal metabolism, environmental factors, and chronic inflammation. Over time, it damages the delicate inner lining of the vessels, making them stiffer and less responsive. This is where vitamins and antioxidants play a critical role in protecting and maintaining vascular health. Vitamin C is essential for the production of collagen, a protein that gives structure and strength to blood vessel walls. Without adequate collagen, vessels become fragile and prone to dysfunction. Vitamin C also supports the repair of damaged tissue, helping vessels maintain their integrity over time. This is especially important in small capillaries, where oxygen exchange occurs. Vitamin E complements this role by protecting blood vessel walls from oxidative damage. It prevents harmful oxidation of fats in the bloodstream, which can otherwise contribute to plaque formation and stiffness. Together, these vitamins create a protective environment that allows blood vessels to remain flexible and functional. Antioxidants do not act overnight, but their effects accumulate. With consistent intake, they slow the progression of vascular aging and improve how vessels respond to movement and nitric oxide. This is why nutrition should not be seen as a quick fix, but as a long-term investment in circulatory health. When combined with gentle movement, antioxidant support helps preserve gains and prevent regression. One of the most underestimated contributors to poor circulation is chronic low-grade inflammation. Unlike acute inflammation, which causes noticeable pain or swelling, chronic inflammation works silently. It gradually damages blood vessels, reduces nitric oxide production, and interferes with normal circulation. Over time, this creates a hostile environment for both blood flow and nerve health. Inflammation causes blood vessels to become less responsive. They lose their ability to relax fully, remaining slightly constricted even when movement signals them to open. This limits blood flow and increases pressure within within the circulatory system. In the legs, this pressure worsens pooling and swelling, further stressing veins and nerves. Diet plays a major role in controlling inflammation. Omega-3 fatty acids found in fatty fish and high-quality supplements help calm inflammatory pathways and improve endothelial function. When inflammation decreases, blood vessels regain flexibility, and circulation improves naturally. Reducing inflammation also benefits nerves. Inflamed tissues create an irritating environment that worsens tingling and pain. When inflammation is controlled, nerves are better able to heal and stabilize. This reinforces the idea that circulation and nerve health are deeply connected and must be addressed together. Addressing chronic inflammation is not about eliminating all stress from the body, it is about restoring balance. When inflammation is kept in check, the circulatory system functions smoothly, supporting comfort, mobility, and long-term health. One of the simplest yet most overlooked causes of poor circulation is dehydration. As people age, the body's thirst signal becomes weaker. Many seniors simply do not feel thirsty, even when their body clearly needs water. As a result, they drink less throughout the day, often without realizing it. This lack of hydration has a direct and powerful effect on circulation. When the body is dehydrated, blood becomes thicker and more viscous. Thick blood does not flow easily through small blood vessels and capillaries, especially in the legs and feet. The heart must work harder to push it through the system, and veins struggle even more to return it upward against gravity. This thickened blood worsens pooling, increases pressure in the veins, and reduces oxygen delivery to tissues. For nerves, dehydration is especially harmful. Nerves rely on steady blood flow to carry oxygen and nutrients. When blood becomes sluggish, nerves are deprived, increasing the likelihood of tingling, numbness, and burning sensations. Many people try to address these symptoms with supplements or exercises while ignoring hydration, which limits the effectiveness of everything else they do. Proper hydration does not mean drinking large amounts of water all at once. In fact, consistent small amounts throughout the day are far more effective. Sipping water regularly keeps blood fluid, improves circulation, and supports every other circulatory strategy. When hydration improves, many people notice that their legs feel lighter and less tight, even before making other changes. Water is not a cure-all, but without it, the circulatory system cannot function efficiently. Movement, nutrition, and supplements all depend on adequate hydration to work properly. This is why hydration should be seen as the foundation of circulation health, not an optional habit. Not all circulation problems come from inactivity alone. Chronic muscle tension can be just as damaging. Many people unconsciously hold tension in their hips, thighs, calves, or feet, especially when sitting for long periods. This tension acts like a partial tourniquet, compressing blood vessels and restricting flow to the lower legs. This is particularly common in seniors who sit with poor posture or who tense their muscles out of habit, stress, or fear of instability. Tight muscles press on veins and arteries alike, narrowing the pathways blood must travel through. Over time, this constant compression reduces circulation and increases discomfort. What makes this problem difficult to recognize is that tension often feels normal. People are unaware they are holding it. They simply notice stiffness, fatigue, or numbness later in the day. When tension combines with prolonged sitting, the effect on circulation is magnified. Blood slows, pressure builds, and nerves become irritated. Releasing muscle tension restores circulation almost immediately. Standing up, gently stretching, or even consciously relaxing the legs can improve blood flow within minutes. This is why brief movement breaks are so effective. They do not just activate muscles, they also release compression on blood vessels. Learning to check in with the body throughout the day is a powerful circulation tool. Relaxing the legs, uncrossing them, and allowing muscles to soften creates space for blood to move freely. Circulation improves not through force, but through release. Temperature has a direct effect on circulation. Cold causes blood vessels to constrict, reducing blood flow to the extremities. Warmth, on the other hand, causes blood vessels to dilate, allowing more blood to reach the tissues. This is why cold feet are often a sign of restricted circulation, and warmth brings immediate relief. Warm foot soaks are especially effective for improving circulation in the lower body. When the feet are exposed to warm water, blood vessels widen, increasing blood flow not only to the feet but throughout the legs. This helps move stagnant blood upward and brings fresh oxygen to tissues that have been deprived. Beyond circulation, warmth also relaxes muscles and reduces tension. As muscles soften, they stop compressing blood vessels, further improving flow. This combination of vessel dilation and muscle relaxation makes warmth a powerful but gentle circulation booster. Warmth also soothes the nervous system. When the body feels safe and relaxed, stress hormones decrease. These hormones normally constrict blood vessels, so reducing them allows circulation to improve naturally. This is why warm foot soaks in the evening are particularly beneficial. They prepare the body for rest while supporting blood flow and nerve health. Used consistently, warmth becomes more than comfort. It becomes therapy. It complements movement and hydration, reinforcing circulation improvements and reducing daily discomfort. When combined with other gentle strategies, warmth helps create an environment where the body can repair and restore itself. Many people treat circulation problems and nerve problems as two separate issues, but in reality, they are tightly linked. Nerves depend on healthy blood flow to survive and function properly. Every nerve fiber requires a constant supply of oxygen, glucose, and nutrients delivered through tiny blood vessels. When circulation weakens, nerves are among the first tissues to suffer. In the legs and feet, this connection becomes especially clear. Reduced blood flow means nerves are slowly deprived of what they need. At first, this shows up as mild tingling or occasional numbness. Over time, if circulation is not restored, nerves become increasingly stressed and begin to malfunction. Signals may become delayed, exaggerated, or completely blocked, leading to persistent numbness, burning, or sharp sensations. This is why treating nerve symptoms alone often fails. Pain relievers, topical creams, or nerve-focused supplements may reduce discomfort temporarily, but if blood flow remains poor, the root problem continues. True nerve healing requires restoring circulation so that nerves can repair themselves. The encouraging truth is that nerves are remarkably resilient when given proper support. Even older nerves can recover function if oxygen and nutrients are restored consistently. This is why improving circulation often leads to gradual but meaningful improvements in sensation, balance, and comfort. The nervous system does not need force, it needs nourishment and stability. Understanding this connection shifts the approach from symptom management to true recovery. When circulation improves, nerves are no longer in survival mode. They regain the ability to communicate clearly, reducing discomfort and restoring confidence in movement. While circulation delivers oxygen, nerves also require specific nutrients to repair and protect themselves. Without these nutrients, nerve recovery is slow and incomplete, even if blood flow improves. This is where targeted nutritional support becomes essential, especially for seniors. B vitamins play a central role in nerve health. Vitamin B12, B6, and folate are particularly important for maintaining the protective sheath around nerves and supporting signal transmission. As people age, absorption of these vitamins often declines, leading to deficiencies that quietly worsen nerve symptoms. A common issue is the form of B12 being used. Many supplements contain synthetic forms that the body struggles to convert, especially in older adults with digestive changes. When the body cannot use B12 effectively, nerves remain undersupported, and numbness persists despite supplementation. Antioxidants such as alpha-lipoic acid further enhance nerve recovery by reducing oxidative stress. Oxidative damage interferes with nerve signaling and slows healing. By neutralizing this damage, antioxidants create a more favorable environment for nerve repair. Nutrition does not replace movement or circulation work, but it amplifies their effects. When nerves receive both adequate blood flow and proper nutrients, recovery accelerates. Sensation improves, discomfort decreases, and long-term nerve health becomes more sustainable. Nerves thrive on use. When sensory input decreases, nerves become less responsive, and the brain begins to lose accurate information about the body. This contributes not only to numbness, but also to balance issues and fear of movement. Gentle nerve stimulation reverses this process by reminding the nervous system how to communicate effectively. Simple actions, such as pressing the feet into the floor, rolling the soles gently, or spreading the toes activate sensory receptors. These receptors send signals up to the brain, reinforcing the connection between the feet and the nervous system. When this input is repeated regularly, nerves become more responsive and reliable. Stimulation works best when it is gentle and consistent. Aggressive pressure can irritate nerves, while light, controlled stimulation encourages healthy signaling. When paired with improved circulation, this stimulation becomes even more effective, as nerves have the resources they need to respond and adapt. Over time, this process improves not only sensation, but also balance and coordination. The brain regains confidence in the lower body, reducing the risk of falls and increasing comfort during movement. This psychological effect is just as important as the physical one. Gentle nerve stimulation is a reminder that healing is interactive. The body responds when it is engaged thoughtfully. By combining circulation, nutrition, and stimulation, the nervous system is given everything it needs to recover and function more smoothly. When circulation problems have been present for a long time, nerves often need extra support to recover fully. One of the most researched nutrients for this purpose is alpha-lipoic acid, often called ALA. What makes ALA unique is that it works on two fronts at the same time. It supports nerve health directly, while also improving how the body uses blood sugar and oxygen, both of which affect circulation. ALA is a powerful antioxidant, meaning it helps neutralize oxidative stress that damages nerves and blood vessels. In poor circulation, waste products build up around nerves, creating an environment that interferes with proper signaling. ALA helps clear this stress, allowing nerves to function more normally. This is why many people with tingling or burning sensations notice gradual improvement when ALA is used consistently. Another important role of alpha-lipoic acid is its effect on blood flow at the cellular level. It helps improve how cells take in glucose and produce energy. When cells function more efficiently, they require less strain on the circulatory system. This indirectly supports better blood flow, especially in small vessels that feed the nerves. What is important to understand is that ALA does not act like a painkiller. It does not mask symptoms. Instead, it supports repair over time. Improvements may be subtle at first, but with consistency, sensation often becomes clearer and more stable. When combined with movement and hydration, ALA can significantly enhance overall recovery. Breathing is often overlooked when discussing circulation, yet it plays a critical role in moving blood back to the heart. Most people breathe shallowly, using only the upper chest. This type of breathing does very little to assist circulation. Deep diaphragmatic breathing, on the other hand, creates pressure changes inside the chest and abdomen that actively help pull blood upward from the lower body. When you inhale deeply using the diaphragm, the pressure inside the chest decreases. This creates a gentle vacuum effect that draws blood toward the heart. At the same time, pressure in the abdomen increases slightly, pushing blood out of the lower veins. Together, these pressure changes significantly improve venous return, especially from the legs. For seniors, this is especially valuable because it does not require physical effort or joint movement. Even people with limited mobility can use breathing to support circulation. Just a few minutes of slow, deep breathing can improve blood flow and reduce feelings of heaviness in the legs. Deep breathing also calms the nervous system. Stress hormones cause blood vessels to constrict, limiting circulation. When breathing slows and deepens, these hormones decrease, allowing vessels to relax. This creates a double benefit: improved blood flow and reduced nerve irritation. Over time, incorporating conscious breathing into daily routine strengthens the connection between the respiratory and circulatory systems. The body becomes more efficient at moving blood even during rest. This makes breathing one of the most underrated yet powerful tools for improving circulation naturally. Gravity works against circulation during the day, pulling blood downward into the legs. But gravity can also be used as a tool when applied correctly. Elevating the legs above heart level allows pooled blood to drain more easily back toward the heart, reducing pressure in the veins and relieving swelling. This simple practice is especially effective in the evening, when blood pooling is often at its worst. After a long day of sitting or standing, the veins in the legs are under increased pressure. Elevating the legs for even 15 minutes gives the circulatory system a chance to reset. Blood that has been trapped below begins to move upward, and fresh blood can flow in more easily afterward. Leg elevation also reduces strain on vein valves. When pressure is lowered, valves can close more effectively, preventing further backward flow. This helps break the cycle of pooling and swelling that many seniors experience daily. In addition to circulation benefits, elevation reduces nerve compression. As swelling decreases, pressure on surrounding nerves is relieved, often easing numbness and discomfort. Many people notice that tingling improves after regular leg elevation, especially when combined with gentle movement beforehand. Using gravity as an ally is a reminder that improving circulation does not always require action. Sometimes it requires positioning. When movement, breathing, hydration, and elevation work together, the circulatory system receives support from multiple angles, making improvement more sustainable. The human circulatory system was never designed for long, uninterrupted sitting. Yet for many seniors, sitting has become the dominant posture of daily life, watching television, reading, eating, or using a phone. While sitting may feel restful, prolonged sitting quietly disrupts circulation, especially in the lower body. When you sit for extended periods, blood vessels in the hips and thighs become compressed. This compression slows the flow of blood into and out of the legs. At the same time, leg muscles remain inactive, which shuts down the venous muscle pump. Without muscle contractions to assist blood return, gravity pulls blood downward, where it begins to pool in the calves, ankles, and feet. Over time, this repeated stagnation weakens vein valves and increases pressure inside the veins. Symptoms such as heaviness, swelling, numbness, and tingling become more frequent and more intense. What makes this especially dangerous is how normal it feels. People do not associate sitting with harm, so they do not take steps to interrupt it. The solution is not to avoid sitting entirely, but to break it up. Even standing for a minute, shifting weight, or moving the ankles can dramatically improve circulation. These small interruptions restore blood flow and prevent the buildup of pressure that leads to discomfort. Circulation thrives on change, not stillness. Crossing the legs is a common habit, often done without any awareness. For many people, it feels comfortable or natural. However, from a circulatory standpoint, leg crossing is highly disruptive. When one leg is crossed over the other, major blood vessels in the thigh are compressed, reducing blood flow to the lower leg. This compression acts much like a kink in a garden hose. Blood struggles to pass through, pressure builds below the point of compression, and circulation slows. Over time, repeated leg crossing contributes to vein stress, increased pooling, and worsening swelling. In seniors, whose blood vessels and vein valves may already be compromised, this habit has an even greater impact. Reduced flow means less oxygen reaches the nerves and muscles, increasing the likelihood of numbness and fatigue. Many people notice that their leg falls asleep more quickly when crossed, which is a direct sign of restricted circulation. Breaking this habit can significantly improve blood flow without any additional effort. Simply keeping both feet flat on the floor or slightly elevated allows blood to move freely. Over time, this small change reduces pressure on the veins and supports healthier circulation throughout the day. Circulation can also be restricted by external pressure from clothing and footwear. Tight socks, restrictive shoes, tight waistbands, or snug pants can compress blood vessels and interfere with normal blood flow. While this compression may seem minor, its effects accumulate over time, especially when combined with prolonged sitting or inactivity. inactivity. Tight socks that leave deep indentations around the ankles are a common culprit. These indentations indicate that blood flow is being restricted. Shoes that squeeze the toes prevent natural foot movement, reducing muscle activation and impairing the venous pump. Over time, this leads to increased pooling, swelling, and nerve irritation. Footwear should support natural movement, not restrict it. Shoes that allow the toes to spread and the ankles to move freely help maintain circulation. Similarly, clothing should feel supportive without creating pressure points that block blood flow. Making small adjustments to clothing choices can have a surprisingly large impact on circulation comfort. When external compression is removed, blood flows more easily, nerves receive better oxygenation, and discomfort decreases. Circulation improves not only from what we do, but also from what we stop doing. Warmth has a direct and immediate effect on blood flow. When the body is exposed to warmth, blood vessels naturally expand, allowing more blood to pass through them. This response is especially helpful in the feet and lower legs, where circulation is often weakest. A warm foot soak is one of the simplest ways to take advantage of this natural reaction. When feet are placed in warm water, blood vessels in the skin and deeper tissues begin to dilate. This increased blood flow helps move stagnant blood out of the feet and lower legs and encourages fresh, oxygen-rich blood to flow in. For many seniors, this results in an immediate feeling of relief. Feet feel warmer, lighter, and more comfortable. Beyond circulation, warm foot soaks relax tight muscles. As muscles soften, they stop compressing nearby blood vessels, which further improves flow. This muscle relaxation also reduces pressure on nerves, often easing tingling or numbness. The calming effect of warmth on the nervous system lowers stress hormones that otherwise cause blood vessels to constrict. Using warm foot soaks regularly, especially in the evening, helps reset circulation after a day of sitting or standing. It prepares the body for rest while supporting healing. This practice does not force change. It gently invites the circulatory system to function more efficiently.
Breathing is more than oxygen exchange. It is also a powerful circulatory tool. Deep diaphragmatic breathing creates pressure changes inside the chest and abdomen that actively help move blood back to the heart. This mechanism is particularly valuable for improving circulation in the legs. When you inhale deeply using your diaphragm, pressure inside the chest decreases. This creates a gentle suction effect that draws blood upward toward the heart. At the same time, abdominal pressure increases slightly, helping push blood out of the lower veins. Together, these effects significantly enhance venous return. Shallow chest breathing does not provide this benefit. Unfortunately, many people adopt shallow breathing patterns due to stress, posture, or inactivity. Over time, this reduces the natural assistance breathing provides to circulation. Relearning deep breathing restores this lost support. Deep breathing also calms the nervous system. When the body relaxes, blood vessels widen, improving circulation throughout the body. For seniors, this makes diaphragmatic breathing a low-risk, high-reward strategy that can be practiced anywhere, sitting, lying down, or even before sleep. Gravity constantly pulls blood downward during the day, making circulation in the legs more challenging. However, gravity can also be used to support circulation when applied intentionally. Elevating the legs above heart level allows pooled blood to drain more easily back toward the heart, reducing pressure in the veins. This practice is especially effective in the evening, when swelling and heaviness are often at their worst. Elevating the legs for even 15 minutes gives vein valves a break and allows circulation to rebalance. As pressure decreases, fresh blood can flow into the legs more easily once they are lowered. Leg elevation also reduces nerve compression caused by swelling. As fluid shifts away from the lower legs, pressure on surrounding nerves decreases, often easing numbness and discomfort. Many people find that regular leg elevation improves nighttime comfort and reduces cramps. Elevation requires no effort, no equipment, and no strain. It works with the body's natural physics rather than against it. When combined with gentle movement and proper hydration, leg elevation becomes a powerful tool for maintaining healthy circulation and daily comfort. Peripheral neuropathy is a term that sounds frightening to many people, especially seniors. It is often described as nerve damage that causes numbness, tingling, burning, or loss of sensation in the feet and legs. Because of how it is commonly explained, many people assume that once neuropathy starts, nothing can be done. However, in a large number of cases, neuropathy does not begin with permanent nerve damage. It begins with poor circulation. Nerves are extremely sensitive to oxygen levels. When blood flow to the legs is reduced, nerves are slowly deprived of oxygen and nutrients. At first, they do not die or break down. Instead, they struggle to function properly. Signals become weaker, delayed, or distorted. This is when people first notice tingling, buzzing, or a dead feeling in the feet. These early symptoms are often reversible because the nerves are not destroyed. They are undernourished. The danger comes when this stage is ignored. If circulation remains poor for months or years, nerves can eventually suffer structural damage. This is why early numbness should never be dismissed as just aging. It is a warning sign that the environment around the nerves is unhealthy. Improving circulation at this stage can restore oxygen delivery, reduce stress on the nerves, and allow them to recover. Understanding neuropathy in this way changes the outlook completely. Instead of feeling hopeless, people realize they still have influence over the outcome. Movement, hydration, breathing, and nutrition are no longer optional lifestyle tips. They become essential tools for protecting nerve health. In many cases, restoring blood flow is the most important step in stopping neuropathy from progressing. Even with good circulation, nerves cannot repair themselves properly without the right nutrients. Among the most important of these nutrients are B vitamins, particularly vitamin B12, B6, and folate. These vitamins play a critical role in maintaining the protective sheath around nerves and supporting the transmission of nerve signals. As people age, absorption of B vitamins, especially B12, often declines. This happens due to changes in stomach acid, digestive enzymes, or medication use. The result is a silent deficiency that may go unnoticed for years. During this time, nerve health slowly deteriorates. Symptoms such as numbness, weakness, balance problems, and tingling gradually appear. One major issue is that many people take B12 supplements without benefiting from them. This is often due to the form of B12 being used. Some forms require conversion in the body before they can be used, and this conversion becomes less efficient with age. When B12 is not properly absorbed or activated, nerves remain vulnerable even though supplementation appears adequate. B vitamins do not work like painkillers. They do not provide instant relief. Instead, they support repair over time. When circulation improves and B vitamins are available in usable forms, nerves regain their ability to insulate themselves and transmit signals clearly. This leads to gradual improvements in sensation, coordination, and comfort. This is why nerve recovery is rarely about one single solution. It is about creating the right conditions. Blood flow brings oxygen. B vitamins provide the building materials. Together, they allow the nervous system to stabilize and heal. Nerves are designed to be used. When sensory input decreases, nerves begin to weaken, and the brain reduces its attention to that area of the body. This process happens quietly. People move less because sensation feels unreliable, and sensation becomes worse because nerves are not being used. This creates a cycle that leads to long-term sensory loss and balance problems. Gentle daily nerve stimulation interrupts this cycle. Simple actions such as moving the toes, pressing the feet into the floor, or rolling the soles over a soft surface send signals through sensory nerves to the brain. These signals remind the nervous system that the feet are still active, present, and important. This stimulation works best when it is calm and controlled. Harsh pressure or aggressive techniques can irritate nerves and increase discomfort. Gentle, repeated input encourages healthy nerve firing and strengthens communication pathways. When done daily, it helps preserve sensation and prevents further decline. Nerve stimulation also supports balance and confidence. The brain relies on sensory feedback from the feet to maintain stability. When this feedback improves, people feel more secure when standing or walking. This reduces fear of movement, which in turn improves circulation and overall mobility. Over time, gentle stimulation becomes a form of maintenance for the nervous system. It does not force healing, but it keeps pathways open and responsive. Combined with improved circulation and proper nutrition, it plays a key role in preserving independence, comfort, and quality of life. Cayenne pepper is often thought of only as a spicy kitchen ingredient, but it has a long history of use in supporting circulation. The active compound in cayenne, called capsaicin, creates a warming response inside the body that directly affects blood vessels. When consumed in small, controlled amounts, capsaicin encourages blood vessels to dilate, allowing blood to flow more freely through the circulatory system. This warming effect is not just a sensation, it is a physiological response. Capsaicin stimulates nerve receptors that signal blood vessels to open slightly. As vessels widen, resistance decreases, and blood can move more efficiently, especially into smaller capillaries in the hands and feet. For people who constantly feel cold in their legs or toes, this effect can be particularly noticeable. Cayenne also helps improve nutrient delivery. When circulation improves, oxygen and nutrients reach tissues more effectively, including nerves that may be struggling due to reduced blood flow. This is why cayenne is often included in natural approaches to improving nerve comfort and reducing heaviness in the legs. It is important to understand that cayenne is not meant to be used aggressively. A small pinch added to warm water or food is enough. The goal is gentle stimulation, not irritation. When used consistently and carefully, cayenne acts as a supportive tool that complements movement, hydration, and breathing rather than replacing them. Nitric oxide plays a central role in circulation by allowing blood vessels to relax and widen. While many people focus on L-arginine as a nitric oxide booster, L-citrulline is often more effective, especially for sustained improvement. Once consumed, L-citrulline is converted into L-arginine inside the body, leading to a more stable and prolonged increase in nitric oxide levels. What makes L-citrulline especially useful for seniors is its efficiency. It is absorbed well and does not break down as quickly in the digestive system. This means blood vessels receive a steady signal to remain flexible rather than short bursts of dilation. Over time, this supports better baseline circulation throughout the day. Improved nitric oxide levels help reduce stiffness in blood vessels and lower resistance in the circulatory system. This makes it easier for blood to reach the legs and feet, even during periods of rest. When vessels are more responsive, gentle movements become more effective, and the venous muscle pump works more efficiently. L-citrulline is not a quick fix. Like many circulation-supporting strategies, its benefits build gradually. When combined with consistent movement and proper hydration, it contributes to long-term improvements in comfort, warmth, and energy in the lower body.
Large arteries and veins often get the most attention, but capillaries are where circulation truly matters. These tiny blood vessels are responsible for delivering oxygen and nutrients directly to tissues and nerves. When capillaries become weak or leaky, fluid escapes into surrounding tissues, leading to swelling and reduced oxygen delivery. Supporting capillary health helps prevent this leakage and improves overall circulation efficiency. Certain natural compounds, including plant-based antioxidants, help strengthen capillary walls and reduce inflammation. When capillaries are healthier, blood remains where it belongs, moving efficiently rather than stagnating. Improved capillary function has a noticeable effect on swelling in the legs and feet. As leakage decreases, fluid buildup reduces, relieving pressure on nerves and tissues. Oxygen delivery improves, which helps nerves function more normally and reduces discomfort. This level of circulation support works quietly but effectively. It does not create dramatic sensations, but over time it leads to lighter legs, better endurance, and more stable nerve sensation. Capillary health is one of the final pieces of the circulation puzzle, tying together movement, nutrition, and recovery into a cohesive system. One of the biggest misunderstandings about health is the idea that more effort always leads to better results. When it comes to circulation, the opposite is often true, especially for seniors. The circulatory system responds best to gentle, repeated stimulation rather than occasional intense effort. Hard exercise done once in a while may feel productive, but it cannot compensate for long hours of stillness. Blood flow is regulated moment by moment. When muscles move even lightly, they create pressure changes that help blood circulate. When muscles stay still, blood slows almost immediately. This means that small movements done regularly throughout the day are far more effective than one long session of exercise followed by inactivity. The body does not remember yesterday's workout when it comes to circulation. It responds to what is happening right now. Gentle movement also keeps stress low. Intense effort can trigger inflammation, muscle soreness, or fatigue, which often leads to longer recovery periods and more sitting. Gentle movement, on the other hand, encourages consistency. It feels safe, manageable, and sustainable. When people move without fear or pain, they are far more likely to keep moving. Over time, this consistency retrains the circulatory system. Veins become more efficient, muscles stay engaged, and blood flow remains steadier even during rest. This is why people who move gently but often usually feel warmer, lighter, and more comfortable than those who push hard occasionally. Circulation thrives on rhythm, not force. Many people believe that long-term discomfort requires complex solutions. In reality, circulation problems often develop from small daily habits repeated over many years: sitting too long, moving too little, ignoring hydration, or holding tension in the body. Because the problem develops slowly, the solution also works best when applied gradually and consistently. Small habits such as moving the ankles while seated, standing up every hour, drinking water regularly, or practicing deep breathing may seem insignificant on their own, but when done daily, they create a powerful cumulative effect. Each habit supports blood flow in a slightly different way, and together they restore balance to the system. The body is remarkably responsive to these changes. Blood vessels adapt, nerves receive better nourishment, and swelling decreases. What once felt like permanent discomfort begins to soften. Pins and needles become less frequent, legs feel lighter, feet feel warmer. These changes may not happen overnight, but they happen steadily. This process is empowering because it puts control back in the hands of the individual. Improvement does not depend on expensive treatments or extreme measures. It depends on awareness and repetition. When healthy habits become automatic, circulation improves naturally as part of daily life. Perhaps the most important shift in mindset is understanding that numbness, tingling, and heaviness are not final diagnoses. They are signals. The body is communicating that something is not working efficiently, most often circulation. These sensations are messages, not punishments. When these signals are ignored, the body escalates them. What begins as mild tingling can turn into persistent numbness or pain. But when the signals are acknowledged and addressed early, the body often responds quickly and positively. Improved blood flow brings oxygen back to tissues, calms irritated nerves, and reduces pressure in the veins. This perspective replaces fear with clarity. Instead of thinking, "my body is failing," the mindset becomes, "my body is asking for support." That shift alone reduces stress, which itself improves circulation. The body works as a system, and when one part receives attention, others benefit as well. Healing does not require perfection. It requires listening. When the body is given movement, hydration, warmth, nutrition, and rest in the right balance, it remembers how to function well. Comfort returns not because time has passed, but because the conditions for healing have been restored. If there is one message to take away from everything you've just read, it is this: the discomfort in your legs and feet is not random, and it is not something you have to simply accept.
The heaviness, the numbness, the tingling, and the cold sensations are your body's way of asking for help. They are signals that circulation is struggling, not proof that your body is failing, and signals can be answered. Your circulatory system is not a static machine that wears out and stops working. It is a living, responsive system that reacts to how you treat it every single day. Gentle movement reactivates the muscle pump in your legs. Proper hydration keeps your blood flowing smoothly. Breathing deeply supports blood return to the heart. Warmth relaxes blood vessels. Nutrition feeds the lining of those vessels and protects the nerves that depend on them. None of these strategies are extreme, and none of them require you to push through pain or exhaustion. What makes this approach powerful is not intensity, but consistency. A few minutes of movement done several times a day is more effective than one hard effort followed by hours of stillness. Small daily habits, repeated over time, can reverse years of circulatory discomfort. This is how the body heals best, slowly, steadily, and safely. It is also important to remember that nerves are not fragile glass. When given oxygen, nutrients, and gentle stimulation, they often recover far more than people expect, even later in life. Many symptoms that are labeled as permanent are actually the result of long-term undernourishment. When circulation improves, nerves calm down, sensation becomes clearer, balance improves, fear of movement fades. Perhaps the most encouraging truth is this: you do not need to do everything at once. Start with one small change. Move your ankles while sitting, drink an extra glass of water, take a few deep breaths, elevate your legs in the evening. These small actions send a powerful message to your body that it is safe to function again. Your body is not your enemy. It has been adapting and compensating for years, doing the best it can with the conditions it has been given. When you improve those conditions, it responds, comfort returns, energy improves, confidence grows. You are not too old to feel better. You are not broken, and you are not out of options. Circulation can improve, nerves can calm, and daily life can become more comfortable again. One gentle, intentional step at a time.